Estrogen. You've probably heard it mentioned in relation to women's health, but do you really understand just how crucial this hormone is? If you're a woman, chances are you've noticed changes in your body over the years. And one of the key players in those changes is estrogen. When estrogen levels start to drop, whether due to aging, menopause, or other factors, it can have a significant impact on your body, mind, and overall well-being. But the problem is, estrogen deficiency doesn't always show up with obvious, immediate signs. Sometimes the effects are sneaky, creeping up on you in ways that might not immediately seem related to hormones. So, how do you know if your estrogen levels are dipping? Let's take a deeper look at how estrogen deficiency affects women and the hidden signs you shouldn't ignore. Now let's start with the basics. Estrogen is a primary female sex hormone produced mainly by the ovaries. It plays a vital role in regulating many functions in the body, from your menstrual cycle to your skin, bones, and even your brain. As women age, especially as they approach menopause, estrogen levels naturally decline. But the decline can start much earlier, even in your 30s or 40s, and the effects of that drop can sometimes be mistaken for other health issues. One of the first signs that women often notice when estrogen levels start to drop is changes in their mood. You may feel more irritable, anxious, or even depressed without really understanding why. This isn't just about feeling a little off. These mood swings can be intense. When estrogen levels fluctuate, it can mess with the neurotransmitters in your brain that regulate mood, like serotonin and dopamine. Mood swings aren't just frustrating. They can impact your relationships, work, and overall happiness. If you find yourself snapping at your loved ones or feeling emotionally overwhelmed more often, it could be due to hormonal changes, not just stress or life's pressures. But it's not just about how you feel emotionally. Estrogen also plays a huge role in your physical health, particularly when it comes to your skin, hair, and bones. When estrogen decreases, your skin may lose some of its elasticity, leading to wrinkles, fine lines, and dryness. You may start to notice that your skin is thinner, drier, and less vibrant. Estrogen helps maintain the skin's collagen production, so when levels fall, your skin's ability to repair itself decreases as well. Hair thinning is another major sign that your estrogen levels are on the decline. It's one of those subtle changes that can be easy to overlook, but as estrogen drops, many women experience thinning hair or increased shedding. This can be especially noticeable around the crown of your head. Estrogen promotes hair growth, and when those levels decrease, the natural hair growth cycle is disrupted, leaving you with hair that doesn't grow as quickly or as thick as it once did. If you're noticing more hair in your brush or in the shower drain, it might be more than just a passing phase. It could be a sign of low estrogen. Now, let's talk about one of the most common and frustrating symptoms women experience when estrogen drops. Hot flashes. These sudden waves of heat that can leave you drenched in sweat are one of the hallmark signs of hormonal imbalance. While hot flashes are most often associated with menopause, they can begin much earlier in some women, especially if their estrogen levels start to drop prematurely. The cause of hot flashes is still not fully understood, but it's thought that they occur because of changes in the part of the brain that regulates body temperature. Estrogen helps to stabilize this system, and when its levels fall, your body's ability to maintain a comfortable temperature can get all out of whack. And speaking of temperature regulation, night sweats are another sign that estrogen may be on the decline. These are essentially hot flashes that occur at night, waking you from a deep sleep and leaving you drenched in sweat. Night sweats can completely disrupt your sleep cycle, leaving you feeling tired, irritable, and mentally foggy the next day. The lack of restful sleep can lead to chronic fatigue, making it harder to focus and function during the day. If you're waking up in the middle of the night, drenched in sweat, it's definitely time to look at your hormonal health. While mood swings, dry skin, hair thinning, hot flashes, and night sweats are some of the more obvious signs of estrogen deficiency, there are a few hidden symptoms that many women overlook or chalk up to other issues. One of these is vaginal dryness. Estrogen plays a crucial role in maintaining moisture and lubrication in the vaginal area. As levels decline, you may start to experience itching, burning, or pain during intercourse. This can lead to a lot of discomfort, and for some women, it can even affect their relationship. Vaginal dryness can also increase the risk of infections, such as urinary tract infections, UTIs, or yeast infections, which are more common when estrogen levels are low. Another hidden sign is joint pain or stiffness. You might notice that your joints are feeling a bit achy, or you're experiencing more stiffness than usual, especially in the mornings or after periods of inactivity. This is often a result of decreased estrogen, affecting the body's ability to repair joint tissue. As estrogen declines, it can also affect your bone health, increasing your risk of osteoporosis. Estrogen helps to maintain bone density, so when levels drop, bones can become more brittle and fragile. This means you're at greater risk for fractures and breaks. Weight gain is another sneaky symptom of estrogen deficiency that's easy to miss. As estrogen drops, it can cause changes in metabolism, leading to weight gain, particularly around the abdomen. Even if you're eating the same and exercising regularly, you may notice your waistline expanding. The hormonal changes can also lead to a slower metabolism, making it harder for you to lose weight, no matter how hard you try. And here's something that many women don't realize. Estrogen affects your heart health. As estrogen levels drop, women may experience changes in cholesterol levels, blood pressure, and blood vessel elasticity, all of which contribute to an increased risk of heart disease. This is why heart disease becomes more common in women after menopause, and it's essential to stay on top of heart health by maintaining a balanced diet, exercising, and keeping an eye on your cholesterol and blood pressure. So, what can you do if you're experiencing these signs? The first step is to get your hormone levels checked by a healthcare provider. Blood tests can show whether your estrogen levels are out of balance, and your doctor can help you figure out what might be causing the changes in your body. From there, you can explore treatment options, which may include hormone replacement therapy, HRT, non-hormonal medications, or lifestyle changes. Managing stress through relaxation techniques, exercising regularly, and eating a nutrient-dense diet can also help manage symptoms and support your overall health. You don't have to just accept these symptoms as a part of aging. With the right knowledge and tools, you can manage estrogen deficiency and find ways to alleviate the symptoms. Talk to your doctor, keep track of your symptoms, and take steps to support your hormonal health with a healthy lifestyle. If you found this helpful, subscribe for more health and wellness tips. And don't forget to share this video with others who might benefit. Thanks for watching. And remember, your health is worth the care and attention you give it.